Local health officials say the next week or two will prove to be pivotal in our plight against the pandemic amid the growing presence of the stealth Omicron on the local front. For more, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Dr. Kim, it's good to have you here in the studio.
Good afternoon.
I also have Dr. Alice Hyung-young-dan at Ms. Medi Women's Hospital live on the line. Dr. Dan, welcome back.
It's a pleasure to be with you today.
Right, Dr. Kim, pundits believe stealth Omicron is to blame perhaps for a prolonged fight against this latest wave. Do you agree?
Well, we actually, you just guys just talked about the stealth Omicron, and then other countries, including the UK, actually the case numbers actually dropped before the stealth Omicron, but then because of the emergence of stealth Omicron, now the case numbers is increased. So in Korea, somehow now just the Omicron and the stealth Omicron, the surge is kind of just overlap. So maybe the chances are maybe we may have just some extended period of just the peak number of just a case, the total case of just COVID-19, but also there was some we actually just government actually predicted some kind of some peak time, but then since then there was some little bit of changes because all those predictions are based on some calculation of the all difference of the variables. But then since then there was some changing of some social distancing guidelines, and in part, and then also this stealth Omicron somehow all just contribute to the maybe just extension of the peak period of the COVID-19.
Right. And Dr. Tan, in the case of a few countries, the Omicron wave began to decline once 20% of the population was infected. Can this criterion be applied here in Korea?
Well, I don't know if every country is following that rule. If we look at what happened in South Africa, for example, they peaked on December 14th when they reached cumulative caseload of 3.2 million cases. They're a country of 60 million people, and so that's roughly 5% of their population. And yet they went down from their peak very steeply. If we want to understand what's going on and what might happen in the future, I think we need to consider what we call the triad, the epidemic triad of virus transmission. So we have to consider what's going on with the virus, the host, and the environment. Here in Korea, we have a very high density in terms of population, but now we have people who are in home care for their care from COVID, convalescence from COVID. And what that means is we now have tens of thousands of children, millions of adults who are convalescing at home. These are infectious people who are at home with other family members. And so in terms of the environment, it's very conducive to having more secondary infections. Also, if we consider what's going on with the virus, of course, we have the rise of the BA.2 subvariant. We know it's 30% more transmissible than BA.1. It's already claimed dominance in the Gyeongnam region here in Korea, and probably it will become dominant either this week or by the end of next week. And so we have this more transmissible variant that is going to be harder to control. And then also, if we look at the host factors here, we have a very large pool of people who may still be vulnerable to infection. Anyone who's had less than 3 doses of a COVID-19 vaccine should be considered vulnerable to infection. That's about 18.8 million people here. If we subtract the 10 million people who've had recent infection, that's 8.8 million people who are still pretty much wide open to getting infected. So if we take into account the virus factors, the environment factors, and then the host factors, I think what we will see is either a plateau at this high level, or we will go down from the peak, but not in such a steep way as other countries have had.
Right. And Dr. Kim, Korea's Western counterparts are battling stealth Omicron after their initial fight with Omicron. But Korea, for its part, appears to be tackling the two variants simultaneously. What are the implications of this dual challenge, so to speak?
Well, before talking about that, we have to just describe a little bit about just stealth Omicron. That actually Dr. Dan said is BA.2. And then one of the big differences compared to the original Omicron, this is a BA.1, is the BA.2 has 8 mutations, which are not actually observed in the BA.1. And then this mutation seems to affect the more efficient spread of the virus rather than just the causing, just immune evasion. So then the recent surge in the UK and some other countries seems to be just some combinatory effects. One of this Omicron, BA.2 effect, and also the easing of the social restrictions, and also some waning immunity. And then many people actually experience some natural infection or just vaccination very earlier before this BA.2. So naturally the immune response is just declining. So that's what has happened. And but actually one of the good thing is that this immune response, after the natural infection by the BA.1, then this infected and then recovered person has a very good immune status, which is actually to protect this person from the infection by the BA.2, because these two viruses very similar. So then in our country, if the two variants surge simultaneously, maybe we might experience a little bit a different pattern that we observed compared to that we observed from the UK and other countries.
Right, I see. Dr. Dan, given the events unfolding in the US and in Europe, COVID-19 looks to be a vicious cycle of retreats and rebounds. Having said that, is herd immunity not a feasible option against COVID-19?
Well, you only get herd immunity when you have a constant, unchanging virus, and you also have durable protection from your vaccine. And we have neither in the case of COVID-19 right now. SARS-CoV-2 is a rapidly mutating virus. It keeps on giving us variants that have high transmissibility, that have very strong immune evasion properties. And we also have the problem of waning of immunity from our vaccines. So we have the problem with the virus that's kind of eating away of the immunity that's formed by vaccines and also natural infection. And then we have our vaccines that are becoming less and less protective against new infection. We also have, of course, breakthrough infections that are transmitting disease to others, not as strongly, but that is still going on. And so for the time being, it looks like achieving herd immunity will be very, very difficult until we have a durable vaccine that offers strong cross protection against multiple variants, both present and in the future.
Right, and hopefully we'll have one in the near future then. Dr. Kim, despite the rampant spread of Omicron here in the country's death toll remains relatively low, according to statistics shared by the government on this Friday. How do you explain this finding?
Well, number one reason is that there's some high vaccination rate in Korea now. As we discussed earlier in this program, that now we have just more than 85% of just the full vaccination. Including the full vaccination, and that's the number one reason. And the second reason is now we have the supply is not really just abundant, but just enough. But then we have now the options for oral drugs, which is now just very efficient. The Paxlovid, and then this Paxlovid is a significant role in just reducing the number of severe COVID-19 patients. Subsequently, reducing number of deaths. And then finally, well, this is not really just accurate, but our some very fast diagnosis of the COVID-19 case would help to the reduce number of deaths, because that actually somehow contribute by expediting prescription of the oral drugs, and then the treatment of the patient with the high risk. And then this death rate is kind of the cumulative number, since it's like over 2 years. But one of the reasons that we actually we have very low fatality rate in Korea is that earlier in pandemic, especially like year 2020, when there was no vaccines available globally, that our country was somehow very successful in that time for the quarantine, those social distancing measures. That time, the way that we can actually prevent the disease progression and then the reducing the death was just heavily dependent on the social distancing guidelines. That actually substantially contributed to reducing number of the total deaths.
I see. Dr. Dan, with regard to those who have sadly lost their lives to COVID-19, authorities have also linked some of those tragic events to pre-existing health conditions. What are your thoughts on that?
I think, of course, underlying chronic medical conditions will place a person at much higher risk for succumbing to COVID-19. But when we look at, what was the death due to COVID-19 itself. What we want to look at is excess deaths per month or per week. And what's clearly the case is that we are seeing far more deaths recently due to Omicron than we would have expected. You know, we know sort of how many people will die from diabetes or heart disease or stroke per week or per month in our country. We have those statistics. But what's going on now is far above and beyond what we would normally expect. And so even though overall the virulence of the Omicron variant is less than that of the Delta strain, when we look at what's going on in terms of the elderly and in people who have high-risk underlying medical conditions, the Omicron strain can still cause severe disease and death. And that's why we've seen during the first, or we've seen since February and March when Omicron was dominant, we've seen more than 7,700 deaths due to COVID-19, whereas say for influenza, we would expect in any given year an average of 5,300 deaths due to influenza. So Omicron is very severe, and of course it's very transmissible, so it's infiltrating our long-term care facilities, and that's where all of the high-risk patients are residing, and it's causing huge outbreaks in these facilities, anywhere from 100 to over 400 cases per outbreak per facility. And so this is what's causing and driving many of these deaths.
And Dr. Kim, Korea has recently approved a second antiviral COVID-19 treatment pill, Lagevrio. What has been shared about its efficacy on perhaps the stealth Omicron?
Well, this Lagevrio, this is the brand name, but this generic name is actually molnupiravir, actually developed by the Merck. And this has been actually talked about just a fairly long time since the last year. And then, well, just regarding this just a specific drug, and this is actually the mechanism of action is very similar to that of the remdesivir. This is basically just inhibiting just virus, just the replication of a genetic material. And then based on the phase 3 clinical trials of this molnupiravir, it was a little bit disappointing because it shows only just 30% of the efficacy compared to the some placebo control. But then the good thing about this drug is that this does not have any some drug-drug interaction, and then there's no just the kidney just the issues, which is actually just a problem with the Paxlovid. In the case of Paxlovid, although the efficacy is very good, it's like 88 or 89% of just efficacy, as long as this drug is taken within the 3 to 5 days after the symptom onset. But then the problem is that, as I told you, there are many just drugs that just showing some drug-drug interaction, and then if there is if any person has some kidney issues, then the person cannot take the Paxlovid. So we need some alternatives, and also. Considering our just current situation now, just many just people are just there are so many just confirmed cases, and then supply, especially from Paxlovid, is just limiting. So I think just government somehow, well, this is my just personal thought, somehow just delaying the some approval of the molnupiravir because there was some little concern about the some safety issues. Although this is not, I mean, to me, it's not really substantial, but just in case, I mean, very just careful. But then now just supply is the Paxlovid is limiting, so that this is kind of very just alternative just medication that can be to think about. In terms of drug safety, this is some sort of just a nucleoside analog, which means this is actually mimicking the structure of some building blocks of the virus genetic material. So this can actually incorporate into the virus some genomic just material, so then just actually mess up with the some genetic information of the viruses. This is how this drug actually works. So, but then the maybe potential side effects is this can also just cause mutation in our just own the genetic material. That's why we actually just this very narrow just some patient groups that actually this drug was actually recommended. But anyway, for the stealth Omicron, just Paxlovid and then remdesivir and then molnupiravir, all just good regardless of just the variant, and because of their just the mechanism of action, they are all good except for the some monoclonal antibodies. So most of the monoclonal antibodies, including our just Korean monoclonal antibodies, antibody, and then the monoclonal antibody developed by some foreign countries, mostly are not effective against Omicron and then the stealth Omicron, except for the bebtelovimab. That's actually just developed by the Eli Lilly recently, and also some Evusheld. That's also some monoclonal cocktails developed by the AstraZeneca.
Right, I see. On the inoculation front, Dr. Tan, reservations for COVID-19 vaccines for children aged 5 to 11 began on Thursday here in the country, as revealed by my colleague Yeon earlier on. But a government survey shows that 6 out of 10 parents are not planning to get their children vaccinated, and 5 out of 10 are actually saying COVID-19 vaccines are more dangerous than COVID-19 infections. How do you respond?
I don't think the numbers support that fear. If we look at a report that was released by the US CDC after 8.7 million doses of the Pfizer vaccine was deployed to children between ages 5 and 11, what they found was there were 100 reports of severe adverse events. There were 3 deaths. One of the deaths occurred in a child who was infected with influenza. And the 2 other deaths happened in children who had very complicated, severe underlying medical conditions. In contrast, in Korea, we've had 2.84 million cases of COVID-19 in children. We've had 11 deaths among them. 9 occurred in children aged 9 and below. And we've also had 16 cases of multi-system inflammatory syndrome in children. And so if you look at what's been going on in terms of the statistics, what happened in the United States among children who actually received the COVID-19 vaccine, and then in terms of the severity, what's been happening here in Korea domestically, the numbers don't really support their fear. And I think that's why in the United States and in many countries around the world, the Pfizer vaccine is recommended for everyone aged 5 years and over.
Right, and going back to the Omicron front, Dr. Kim, what specific countermeasures do you propose to perhaps better prepare for a greater spread of the stealth Omicron here on the local front?
Well, I think compared to the original Omicron BA.1, I think we could just maintain the same strategy against this stealth Omicron. There's nothing that we actually just think about. But the one thing that I can actually suggest, and I also now I just heard that the government is also just considering the approval of another the treatment option, which is I just talked about Evusheld, developed by the AstraZeneca. This is a combination of 2 monoclonal antibodies. And then this monoclonal antibody, this cocktail is very special because there are certain people who can get actually just vaccinated, and even after vaccination, they can get the very substantial immune responses. So in those kind of immune compromised people, this Evusheld can be just used as a preventive purpose, not the some treatment purpose. Once we actually inject this monoclonal antibodies, then this monoclonal antibody can last for about just 6 months. So, so this is kind of just a passive vaccination instead of active vaccination. Active vaccination is that those are what we are doing right now. So we are actually injecting some the vaccine antigen and then elicit some immune responses. But in this case, immune-compromised person, they cannot elicit those kind of immune responses. So this actually, instead of just eliciting just the immune response, we are actually giving the antibodies just directly to this patient. So this can be something that we can actually just think about right now.
Right. And Dr. Dan, one final question to you. Do you suppose that we need to perhaps reimpose some of our COVID-19 restrictions to deal with a potential surge in stealth Omicron in the country? Very briefly speaking.
Right. Well, if we consider this last Monday, based on the risk assessment report, there were more than 500,000 cases who were high risk, age 60 and above, from the last week alone. We have in the provinces, in terms of incidence, it's exceeding hospital capacity by 142%. In the Seoul metropolitan area, hospital capacity relative to incidence, or I should say the other way around, is 91%. There are 5 cities and provinces that have less than 10 ICU beds left for COVID patients. So if you take all this into account, given that we are going to be dealing with a more transmissible BA.2 strain, we talk about the virus, the environment, and the host. We have to change either the host or the environment to take care of the increased transmissibility that we will be seeing with the virus. That seems logical to me because hospital capacity is very, very strained right now.
Right, it is. All right, Dr. Dan, as always, thank you very much for your thoughts. I'm also taking note of your show of solidarity with the sufferings of the people over in Ukraine there, Dr. Dan. Thank you as always. And Dr. Kim here in the studio, thank you for being with us today.